our presentation is on child abuse and its influence on cardiovascular disease, and it is by us. So to prepare for our study, we first looked at other literature of similar study. We investigated 3 pieces of literature. One focused on adverse childhood experiences and stroke or ischemic heart disease. Another study also used ACEs as the exposure variable and ischemic heart disease as the outcome. And a third study considered all cardiovascular disease, but only physical child abuse as the exposure. A couple gaps in the literature that we saw was that the first 2 studies only focused on ischemic heart disease or stroke, which does not encompass all of cardiovascular disease. And the third study only considered physical child abuse as the exposure variable, even though it considered all cardiovascular disease. With these gaps in the literature, we were brought to the research question, is there a relationship between child abuse and cardiovascular disease?
The cross-sectional study being used is a secondary analysis that utilizes data from the Kentucky Women's Health Registry. The data was collected via surveys from 2006 to 2014. In order to be included, participants must be women aged 18 and older living in Kentucky. They must have completed the registry, and they must have reported experiencing or not experiencing child abuse and reported experiencing or not experiencing cardiovascular disease. The final number of participants came out to be 8,056 women. Once this number was found, results were calculated using odds ratios with a 95% confidence interval and demographic percentages. These ratios were done using the multivariable logistics and were adjusted for age, pain-limiting activity, ever smoking, and problem alcohol use. Data analysis was done using the SPSS program. Child physical abuse was described as any physical act of violence, such as hitting or kicking, that was dealt by a guardian, whereas child sexual abuse was described as any sexual act done by a guardian on a child. Lastly, researchers define heart disease as the leading cause of hospitalizations and death in the United States.
So as Kayla previously stated, we determined that ever smoking, age, pain-limiting activity, and problem alcohol use would be our confounding variables and adjusted for them accordingly. In the bar graphs, display why we thought they would be the best confounding variables to choose based on the data we were given, because in both the outcome and exposure, there appears to be a relationship in that there are more people who are in this group that have experienced both of them. For our unadjusted odds ratio, we found that people who are exposed to childbirth or child abuse are 1.913 times more likely to experience cardiovascular disease than those who are not. While when we adjusted for our confounding variables, the rate went a little bit lower, but still found that people were more likely to experience cardiovascular disease if exposed to child abuse. And even being exposed only to one type of child abuse, such as physical or sexual, also showed that there are increased odds for cardiovascular disease. And people exposed both to physical and sexual abuse are the most likely and the most at risk for cardiovascular disease. So this begs the question on why is this important to public health and what can we do to help this problem? So public health initiatives that focus on reducing cardiovascular disease need to address the role child abuse plays. This is a big issue and a big thing to take on. So it's going to take multiple types of interventions, including primary and secondary, to prevent not only child abuse, but its effect on health problems, such as cardiovascular disease.
There are several limitations to this study. The first limitation was this was a self-reported survey from a convenient sample, which might not be representative of the true population. Second limitation is that the chosen population was women in Kentucky, which means that our results cannot be generalized to a larger population without further investigation. A third limitation is possible underreporting of child abuse because individuals do not want to share their abuse or are so traumatized that they also do not want to share their abuse, decreasing the odds. A final limitation is that there is no data on high blood pressure diabetes, depression, BMI, and childhood stressors that studies have shown are important factors to adjust for. And these are references and acknowledgements.